HAZWOPER. Chapter 10. Toxicological effects. Presented by Active Environmental Training. Remember that you can contact Active Environmental Training at any time if you feel you have any comments or concerns related to this, or any other environmental or safety topic. Contact Active Environmental Training at 407-860-0369. Or visit us in internet at www.activet.com. Remember that your comments or concerns are always welcome. Let's begin with our presentation. Terminal learning objectives. Upon completion of this section, you should demonstrate the ability to recognize the 4 pathways of entry, differentiate between local and systemic toxicity, differentiate between acute and chronic toxicity, discuss potential effects of exposure to carcinogens, illustrate instances of organ toxicity, and elucidate the 4 categories of toxic chemical interactions. Toxicological effects. Several factors influence the degree of toxicity or the effects of a substance, such as its method of entry into the body, the frequency and intensity of exposure, the characteristics of the toxic substance, among others. Xenobiotics induce various types of toxicity through different mechanisms. While certain chemicals are inherently toxic, others require metabolic processes or chemical alterations within the body to become toxic. As Paracelsus famously stated, the most crucial factor among these is the dosage. This section will examine various types of toxicity. Ways of entry. Toxins can enter the body through 4 primary pathways. Absorption. Toxins are absorbed through the skin or mucous membranes, including the eyes. Ingestion. Toxins are swallowed. Injection. Toxins are introduced via a needle or sharp object. Inhalation. Toxins are breathed or inhaled into the body. Among these, inhalation stands as the primary route of toxin entry for employees. Understanding these entry routes enables us to implement preventive measures to hinder their access. Reversible and irreversible consequences. The outcomes of chemical exposure can be categorized as either reversible or irreversible. Reversible effects are those from which the body can recuperate through self-repair mechanisms. For instance, exposure to a specific compound may temporarily impair or alter liver function, but once the compound is eliminated, the liver will regain its normal function. On the other hand, irreversible effects are those from which the body cannot recover. For instance, damage to the central nervous system caused by toxicity is typically irreversible. Localized and systemic toxicity. Toxic effects are typically classified based on where they occur within the body. Local toxicity refers to a reaction that happens at the point where the toxin comes into contact with the biological system, which is typically the body itself. Conversely, systemic toxicity elicits a response at a location distant from the point of contact between the toxin and the body. Systemic toxins spread far from their entry point, often through the bloodstream. Target organs. Numerous xenobiotics act as systemic toxins, exerting their effects solely on particular target organs that are often unrelated to the entry point. Conversely, some xenobiotics have the capability to harm any cell or tissue they come into contact with. The specific target organs affected by the toxin can vary depending on the dosage and route of exposure. For instance, following acute exposure to a particular chemical, the target organ may be the nervous system, whereas with chronic exposure to the same chemical, the target organ may shift to the liver. Expression of systemic toxicity. Systemic toxicity can present itself in several forms, such as acute toxicity, subchronic toxicity, chronic toxicity, carcinogenicity, developmental toxicity, and genetic toxicity in somatic cells. Acute toxicity. Acute toxicity typically manifests shortly after exposure, occurring within hours or days. An acute exposure often involves a single dose or a series of doses received within a 24-hour period. Mortality poses a significant concern in cases of acute exposure. For instance, in 1984, around 5,200 individuals lost their lives, while several thousand others suffered permanent or partial disabilities following exposure to methyl isocyanate, MIC, due to an industrial accident in India. Each year, numerous fatalities result from inhaling carbon monoxide emitted by malfunctioning heaters. Additionally, non-lethal acute effects may also manifest, such as convulsions and respiratory irritation. Chronic toxicity. Chronic toxicity signifies the gradual accumulation of harm to particular organ systems over an extended period, often spanning months or years before clinical symptoms become evident. Damage resulting from subclinical exposures may remain unnoticed initially. However, with repeated or prolonged exposure over time, the cumulative effect of these subclinical exposures gradually intensifies until it surpasses the threshold for chronic toxicity. Eventually, the damage becomes severe enough to impair the normal function of the affected organ, leading to a range of chronic toxic effects. Examples of chronic toxicity. Instances of chronic toxic effects encompass cirrhosis observed in individuals who have consumed ethanol for numerous years, chronic kidney disease seen in workers with prolonged exposure to lead, chronic bronchitis commonly found in long-term cigarette smokers, and pulmonary fibrosis, known as black lung disease, prevalent among coal miners. Subchronic toxicity. Subchronic toxicity arises from recurrent exposure over a span of several weeks or months. This pattern of exposure is frequently encountered in human exposure to certain pharmaceuticals and environmental substances. For instance, taking Coumadin tablets, blood thinners, over several weeks as a treatment for venous thrombosis can lead to internal bleeding. Similarly, workplace exposure to lead over several weeks can result in anemia. Carcinogenicity. Carcinogenicity involves a multifaceted process of abnormal cell growth and differentiation that can culminate in cancer. This process is typically characterized by at least two distinct stages. Initiation, during which normal cells undergo irreversible alterations. Promotion, wherein initiated cells are encouraged to advance towards cancerous development. Chemicals can function as either initiators or promoters in this process. The process of abnormal cell growth. The initial transformation to neoplastic cells arises from mutations in cellular genes responsible for regulating normal cell functions. These mutations can lead to aberrant cell growth, potentially involving the loss of suppressor genes that typically inhibit abnormal cell proliferation. Numerous other factors contribute to this process, including growth factors, immune suppression, and hormonal influences. Tumors. A tumor, or neoplasm, represents unregulated cellular growth. Benign tumors proliferate at their original site, do not infiltrate nearby tissues, metastasize, and are generally manageable. In contrast, malignant tumors, or cancers, invade surrounding tissues or spread to distant locations, posing greater treatment challenges and often resulting in fatality. Developmental toxicity. Developmental toxicity concerns adverse effects on the developing embryo or fetus. Such effects can stem from exposure to toxicants prior to conception by either parent, or from exposure to the mother and her developing embryo or fetus during pregnancy. Types of developmental toxicity. There are three fundamental categories of developmental toxicity. Chemicals induce developmental toxicity through two primary mechanisms: directly affecting embryonic cells, resulting in cell death or damage that can disrupt normal organ development. Inducing mutations in germ cells of parents, which are then passed on to the fertilized ovum. Some fertilized ova carrying mutations develop into abnormal embryos. Genetic toxicity. Genetic toxicity arises from DNA damage and alterations in genetic expression, a process commonly referred to as mutagenesis. The genetic alteration resulting from this process is termed a mutation, with the agent responsible for inducing the change referred to as a mutagen. Types of genetic change. There are three primary forms of genetic change. If the mutation arises in a germ cell, it can be inherited by subsequent offspring. In such cases, the exposed individual typically experiences no immediate effects, as the impact is transmitted to future generations. When the mutation occurs in a somatic cell, it can lead to modified cell growth, such as cancer, or cell death, such as teratogenesis, in the affected individual. Organ-specific toxic effects. There exists a variety of organ-specific toxic effects. In this segment, we will explore each of the following types. Blood/cardiovascular toxicity. Dermal and ocular, eye, toxicity. Genetic toxicity, germ cells. Hepatotoxicity. Immunotoxicity. Nephrotoxicity. Neurotoxicity. Reproductive toxicity, and respiratory toxicity. Blood and cardiovascular toxicity. Blood and cardiovascular toxicity arises when xenobiotics directly impact cells within circulating blood, bone marrow, and the heart. Examples include hypoxia resulting from carbon monoxide binding to hemoglobin, obstructing oxygen transport. Decreased circulating leukocytes due to chloramphenicol damaging bone marrow cells. Leukemia stemming from benzene's harmful effects on bone marrow cells, and arteriosclerosis caused by cholesterol accumulation in arteries and veins. Dermal toxicity. Dermal toxicity may stem from direct contact or internal distribution of toxins to the skin, leading to effects ranging from mild irritation to severe changes like corrosiveness, hypersensitivity, and skin cancer. Examples include dermal irritation from skin exposure to gasoline. Dermal corrosion due to skin exposure to sodium hydroxide, Li. Dermal hypersensitivity following skin exposure to poison ivy, and skin cancer resulting from arsenic ingestion or skin exposure to UV light. Eye toxicity. Eye toxicity arises from direct contact or internal distribution to the eye, with the cornea and conjunctiva directly exposed to toxicants. Thus, occupational exposure to chemicals may lead to conjunctivitis and corneal erosion. Many household items can cause conjunctivitis, pink eye. Chemicals circulating in the bloodstream can distribute to the eye, causing corneal opacity, cataracts, and damage to the retina and optic nerve. Eye toxicity examples. Instances of eye toxins include acids and strong alkalis, which can induce severe corneal corrosion, corticosteroids, which may lead to cataracts, and methanol, wood alcohol, which can harm the optic nerve. Hepatotoxicity. Hepatotoxicity refers to toxicity affecting the liver, bile ducts, and gallbladder. The liver is particularly vulnerable to xenobiotics due to its extensive blood supply and metabolic functions. Consequently, the liver is exposed to high concentrations of such toxicants or their metabolites. Immunotoxicity. Immunotoxicity pertains to toxicity impacting the immune system, manifesting in various forms including hypersensitivity, allergies and autoimmune reactions, immunodeficiency, and uncontrolled proliferation, such as leukemia and lymphoma. The immune system's normal function involves recognizing and defending against foreign substances through cellular engulfment and antibody production. Immunotoxicity examples. Examples of immunotoxicity encompass contact dermatitis resulting from exposure to poison ivy, systemic lupus erythematosus observed in workers exposed to hydrazine, immunosuppression induced by cocaine and leukemia triggered by benzene exposure. Nephrotoxicity. The kidneys are particularly vulnerable to toxic substances due to two primary factors: their high blood flow rate, which facilitates the transport of toxins into the kidneys, their role in filtering large quantities of toxins, which can accumulate in the kidney tubules. Nephrotoxicity refers to toxicity affecting the kidneys, which can result in systemic effects such as reduced capability to eliminate bodily wastes, impaired maintenance of fluid and electrolyte balance, and decreased production of crucial hormones, such as erythropoietin. Neurotoxicity. Neurotoxicity denotes the harm caused by toxic substances to cells within the central nervous system, brain and spinal cord, and the peripheral nervous system, nerves outside the CNS. The main categories of neurotoxicity include neuronopathies, injury to neurons; axonopathies, damage to axons; demyelination, loss of insulation around axons; and interference with neurotransmission. Reproductive toxicity. Reproductive toxicity refers to the harm caused by toxic substances to either the male or female reproductive system. The resulting toxic effects may include reduced libido and erectile dysfunction, infertility, disrupted pregnancies, including abortion, fetal death, or premature delivery, infant mortality or childhood illness, changes in the sex ratio and occurrences of multiple births, chromosomal abnormalities and birth defects, and childhood cancer. Respiratory toxicity. Respiratory toxicity refers to the impact on both the upper respiratory system, including the nose, pharynx, larynx, and trachea, and the lower respiratory system, comprising the bronchi, bronchioles, and lung alveoli. Examples of respiratory toxicity include pulmonary irritation, asthma and bronchitis, reactive airway disease, emphysema, allergic alveolitis, fibrotic lung disease, pneumoconiosis, and lung cancer. Chemical interactions. Human exposure typically involves multiple chemicals simultaneously rather than just one. The toxicity of a combination of chemicals can either be stronger or weaker than the known toxicity of the individual chemicals. The impact of one chemical on the toxic effect of another is termed an interaction. In the next slide, we will explore the various types of chemical interactions. There are 4 fundamental categories of interactions that may arise when chemicals are combined. Each type is determined by the anticipated effects resulting from the individual chemicals. These types of interactions include additivity. A combination of 2 or more chemicals is the sum of expected individual response. Antagonism. Exposure to one chemical results in a reduction in the effect of the other chemical. Potentation. Exposure to one chemical results in the other chemical producing a greater effect than if given alone. Synergism. Exposure to one chemical causes a dramatic increase in the effect of another chemical. Quantitative table. This table displays the percentage of the population impacted by individual exposure to chemical A and chemical B, as well as exposure to the combination of chemical A and chemical B. In this table, we will look at the type of interaction, the toxic effect, and the combination effect of chemicals A and B. The first type of interaction is additivity. Toxic effect of chemical A will be 20%. Toxic effect of chemical B will be 30%. The combined effect of A and B will be 50%. The next type of interaction is antagonism. Toxic effect of chemical A will be 20%. Toxic effect of chemical B will be 30%. The combined effect of A and B will be 5%. The next type of interaction is potentiation. Toxic effect of chemical A will be 0%. Toxic effect of chemical B will be 20%. The combined effect of A and B will be 50%. The next type of interaction is synergism. Toxic effect of chemical A will be 5%. Toxic effect of chemical B will be 10%. The combined effect of A and B will be 100%. Additionally, it specifies the type of interaction. As evident from the data, additivity results in a rise in the affected population, whereas synergism leads to a significant increase in the affected population. Additivity. Additivity stands as the most prevalent form of drug interaction. Examples of additive reactions involving chemicals or drugs include concurrent ingestion of two central nervous system (CNS) depressants, such as a tranquilizer and alcohol, resulting in depressive effects equivalent to the combined impact of each drug. Interference with nerve conduction caused by organophosphate insecticides, with the combined toxicity of two such insecticides being equal to the sum of the toxicity of each individually, and induction of liver toxicity by both chlorinated insecticides and halogenated solvents, with the hepatotoxicity of a formulation containing both being equivalent to the combined hepatotoxicity of each component. Antagonism. Antagonism often serves as a desirable effect in toxicology and forms the basis for many antidotes. Examples of antagonism include physiological antagonism, where a severe drop in blood pressure resulting from a barbiturate overdose can be reversed by administering a vasopressor. Chemical antagonism, exemplified by the reduction of mercury toxicity through chelation of mercury ions with dimercaprol. Disposition antagonism, where swallowed poison is absorbed by introducing charcoal into the stomach, and receptor antagonism, where carbon monoxide poisoning is treated with oxygen to displace carbon monoxide from hemoglobin receptors. Potentiation. Potentiation arises when a chemical lacking specific toxic effects enhances the toxicity of another chemical. Examples of potentiation include significant enhancement of carbon tetrachloride hepatotoxicity in the presence of isopropanol, as may occur in workplace exposures, and increased risk of fatal hemorrhage due to competition for binding sites on plasma albumin by drugs, leading to elevated levels of free warfarin. Synergism. Synergism can result in serious health consequences, where exposure to one chemical significantly amplifies the effects of another. Examples of synergism include greater risk of lung cancer resulting from exposure to both cigarette smoke and radon, surpassing the combined risks of each individually. Elevated risk of lung cancer due to the combined exposure to asbestos and cigarette smoke, exceeding the cumulative risks of each component, and substantially heightened hepatotoxicity resulting from the combination of ethanol and carbon tetrachloride, surpassing the combined hepatotoxic effects of each substance. Combinations of interactions. Various types of interactions may occur at different target sites for the same combination of two chemicals. For instance, chlorinated insecticides and halogenated solvents, commonly utilized together in insecticide formulations, can induce an additive interaction leading to liver toxicity. However, this same chemical combination may result in a different type of interaction within the central nervous system. While chlorinated insecticides stimulate the central nervous system, halogenated solvents depress it. Consequently, simultaneous exposure to these chemicals may yield an antagonistic interaction. Summary. Toxicants are frequently encountered in occupational settings and, when workers are inadequately protected against them, can elicit adverse short and long-term effects. These toxicants can provoke either local or systemic effects and exhibit either acute or chronic toxicity. While a toxicant can exert individual effects, its impact may vary, becoming more or less severe, or affecting additional systems when combined with exposures to other toxicants. Thus, a comprehensive understanding of these toxicological effects and safeguarding against various routes of entry are imperative for preventing detrimental exposures. This was HAZWOPER. Chapter 10. Toxicological effects. Presented by Active Environmental Training. Remember that you can contact Active Environmental Training at any time if you feel you have any comments or concerns related to this, or any other environmental or safety topic. Contact Active Environmental Training at 407-860-0369. Or visit us in internet at www.activet.com. Remember that your comments or concerns are always welcome. Let's move on to the next chapter. Thank you for your attention.